Here we go into hour two on a great day for Talk Radio. First day in November. Last night, of course, a very, very eventful night at the household at the Oakley compound where we did up the front welcome area where, the lovely Briar bought a plastic cat at Shoppers years ago, and it sets up a big screech and a squeal with its green eyes glowing and its head turning. It's like Linda Blair in The Exorcist, the head spinning around. I think she spent $40 about 10 years ago. It's always eventful when the kiddies, some kids were too intimidated and scared to come up. I mean, I didn't know if I felt honored by that or a little worried, but nonetheless, many, many parents in attendance as well. Drinking from flasks, as I noted, out onto the street. But anyway, we were all in costume, in our regalia, and it was. I told you about the kid who came as Ed Sheeran. There were a couple of other little kids. I thought they were ghosts at first because they had like white sheets, looked like togas, and some parsley or something wrapped around their head, spinach. And I said to the kid, "What are you?" He said, "Socrates." And this is his little brother, Plato. They had the same anyway, it was very charming, very endearing. And that was yesterday. And yesterday's gone, as the song would say. So here we are. We sally forth. It's just been one of those days where... hard to believe time's passing as quickly as we're into November. But 50 years ago on this date, the Toronto Sun launched. 50 years ago, some of the day oneers, they are few and far between. One of whom, I don't know if Mark Bonikowski, but he's all around the net when it comes to that era when this paper first launched. He's going to join us at the bottom of the hour. Right now on the line with us is Dr. Sharon Cohen, the head medical director at the Toronto Memory Program. There's a fascinating study that's being conducted in London, England, and it has to do with memory. And so I wanted her to weigh in and draw the connection to Alzheimer's research and so on and so forth. And she's our go-to person on that matter. Dr. Cohen, good to have you here on the Oakley Show. Good afternoon.
Hi, John. Great to be with you. Your Halloween decoration sounds very intimidating. I'll have to get up the courage to visit you next year.
Right. I never thought that would be sort of the litmus test or barometer to coming for some sweet confections. You know, you had to have the courage to come up the walk. We'll have to address that next year. However, that being said, let me ask you about this study that's being conducted, I guess, and has its implications for Alzheimer's research in London, in the UK. Tell us about the study and why it's important for Alzheimer's research.
Yes, of course. It's fascinating. I want to just mention to your listeners that I am not directly involved in the study. However, I am aware of the study, and I can tell you sort of the broad strokes and why it's important. We have known that the London Cabbies, who get their green badge for doing this incredible period of study and testing to know the 25,000 streets in London that are arranged willy-nilly, have substantial benefit to their brain from studying the navigation routes and becoming experts. And these individuals start out with normal-sized brains, and particularly an area deep in the brain on both sides of the brain called the hippocampus, which is important for learning new information and retrieving information. It's like a relay station. And when these would-be cabbie drivers and successfully trained cabbie drivers complete their course and continue to navigate the streets of London, their hippocampus grows. So it gets larger. And what does that mean? Well, that means the cells are greater in number, so we're actually growing more brain cells there. That's pretty fascinating. So we used to think you're born with the brain cells you have, and it's all downhill after that. You just gradually lose brain cells. But actually, in the hippocampus, you're adding more brain cells, and you're adding more connections, so networks, connections between brain cells. And so the size increases. And this is important because this structure, the hippocampus, is exactly the structure that shrinks in Alzheimer's disease. So can we take a page out of the cabbie driver's repertoire and do something to help the shrinking hippocampus in Alzheimer's disease? Well, in the study that is being done now, individuals who are these expert cabbie drivers that have really superior navigational skills, they're undergoing what we call functional MRI. So not just an MRI scan to take a picture of the structure of the brain, but actually to look at what parts of the brain light up when they think about routes or think about getting from Trafalgar Square to Cairn Cross Station or something like that. You know, what parts of the brain and brain networks are activated. And because we know their navigation practice, their day-to-day job makes their brain stronger and better. Can we stimulate the brain in particular regions or networks in the brain in people who are at risk for Alzheimer's disease or who have developed Alzheimer's disease to try and fortify those brain areas? So it sounds a bit science fiction-like, but I think it's well within our grasp that if we understand better how this larger structure is functioning so much better to give superior navigational skills, the poor folks with Alzheimer's disease who are challenged perhaps just to find their way around their house or who are prone to getting lost in a shopping mall, is there something that we can learn from these superiorly trained brains that can apply to them? That's the gist of the study.
It's magnificent, very intriguing. Dr. Sharon Cohen's with us, the head medical director at the Toronto Memory Program, and just elucidating on this study that's being conducted in London in the UK, insofar as it has implications for Alzheimer's treatment, potentially, because it has to do with, as she said, the part of the brain that retains memory, which atrophies, I guess, in Alzheimer's patients. If I'm misusing that word atrophy, because I'm curious now.
No, you got it. Yeah, atrophy just means in the brain anyway that you're losing brain cells. And in Alzheimer's disease, we lose brain cells, but we lose a disproportionate number in the hippocampus, this vital structure. And so we don't want to do that. We want to add brain cells. And since the brain is capable of regenerating, what would it take? We know that, or we think we know that cognitive engagement, exercise helps the brain be more resilient. So people will do crosswords and other kinds of brain games. But maybe navigation is really important. Maybe some games to do with, following routes or learning new ways to get from here to there. Maybe that's even more effective than crosswords. Who knows?
And to dial this back into the study conducted on the London Cabbies in the UK, because it's a four-year test before they're given a full license. And again, when we talk about, some of the intricacies behind the test, they have to prove they can find 100,000 businesses and landmarks using the roughly 26,000 streets in a 6-mile radius of London's center point. So this is not with GPS tracking or anything like that, but they have to memorize and know this. These are not individuals with a special aptitude for this. Could we say it's just John or Jane Q. Public who have developed this particular aptitude or brain power because they've submitted themselves to testing for a 4-month or a 4-year period? Could we draw from that these are not like special individuals in any way, shape, but it's just regular John and Jane Q. Public?
Well, a previous study to answer exactly that question, John, was done and reported in 2011 and showed that the people who started out with this cabbie training had the same size hippocampus as those who are not involved in navigation skills, people from all walks of life. So they start out with the same size brain structures. Perhaps they have a predilection or special interest in or ability to follow routes and find their way around. Otherwise, I don't think they would want to be cabbie drivers. But from a structural standpoint, the brain looks the same. And it's only with the training that we start to see the difference between the cabbie driver in training versus their baseline and the regular person who's not a cabbie driver. And then remarkably, even after these 3.5, 4 years of training, as a person continues to navigate the roads in London, that hippocampus still gets bigger. So it seems to benefit. The more you use it, the more it grows. And so what a wonderful way to build in brain resilience or generate new brain cells if continued use. Really, it doesn't seem that a cap has been found. So the longer you drive a cabbie or work as a cabbie driver, the bigger that hippocampus grows. So it's really quite remarkable.
It's interesting. So the brain is likened to a muscle. You use it or you lose it. Here's my other curious aspect of this. If the brain has atrophy, let's say the hippocampus there in the area where memory is retained, can you reverse it, say, in Alzheimer patients by, maybe painstakingly and patiently administering memory tests?
Well, when brain cells are lost, it's to some extent a matter of degree. So if you lose some brain cells, other parts of the brain can take over. You still have some networks that are resilient and can step in. However, the more brain cells you lose, the harder it is for the remaining brain cells to take over the function. So I think treating early in Alzheimer's disease, diagnosing early, and trying to either through specific lifestyle strategies and brain exercises, and hopefully in the future through medication as well, we'll be able to slow down the loss of brain cells and allow the brain the opportunity to grow some new brain cells.
Dr. Cohen, is Alzheimer's hereditary to a certain extent? Is it nature versus nurture? How does that work?
It has both components. There are a small proportion of individuals in the world who have Alzheimer's based directly on an inherited gene mutation, but the majority of people who develop Alzheimer's disease, so 99%, not the 1% with the gene mutation, but 99%, will have Alzheimer's disease on the basis of a combination of risk genes, which don't guarantee you get it, versus protective genes. And so this kind of mix of some risk genes, some protective genes that'll, fall out differently person to person. And then there are probably some environmental factors that we're not entirely sure of. We know this disease strikes people from all walks of life, all countries, all backgrounds. And it will be very interesting to know in these very skilled cabbie drivers who have really put their brains through such a workout, are they more resilient against development of Alzheimer's disease?
Yeah, I'm just wondering, if there have been a critical mass of cabbies that have been studied. In other words, the study group is large enough that you might extrapolate from that whether or not they've avoided the early onset of Alzheimer's because of this memory work. Would this be a typical sample, say, of the populace that some members might have devolved to a point their brains where they've had early onset Alzheimer's?
Yeah, I haven't heard anything like that reported yet from the cabbie studies, but that's a high interest question. This amount of brain exercise combined with the knowledge that the hippocampus has actually benefited from this and grown in size, is this protective to brain? And not only do these individuals have a lower incidence of developing Alzheimer's, but if they do develop it, do they develop it at a later age, suggesting that they are forestalling a disease process because of their cognitive reserve? So these are questions still to be answered, but they're very good ones, they're very interesting ones. And one could think about other areas of intense study, musicians who use a different part of their brain, or people who perhaps are actors, or other people in the creative arts who use, yet again, different parts of their brain. Do they have some special resilience against Alzheimer's? So a whole field of study that's fascinating.
Absolutely, and certainly worthwhile insofar as, the onset of Alzheimer's is always torturous for families and the individual in question, so hopefully we can make great strides, and this is just part and parcel to that, studying the brains of London, UK cabbies, because they have great memory retention. Dr. Cohen, most insightful. Really appreciate your time this afternoon, and all the best in the research that you're doing.
Such a pleasure, John. You too. Thanks so much. Take care.
You got, and you. Dr. Sharon Cohen, Head Medical Director at the Toronto Memory Program. Well, memory serves, it was 50 years ago on this date. The Toronto Sun launched. At the bottom of the hour, we're going to talk to Mark Bonikowski, columnist with this paper, and he's almost a day oneer. I don't want to age him, but we'll go back in time and just recap some of the highlights and where journalism has really gone in its evolution or devolution, as the case may be. Before we get to that, we're going to find out about, how the highest price of milk in recent memory, there's memory again, has sparked criticism of the supply management. This was the thing that was Bernier was railing against. Anyway, we're going to talk about that next and see where we're going, because this could have implications for a lot of people's household budgets. In moments, we'll get to that story. First, we'll get out to the roads. 21 past the hour at a check of chopper traffic. Ari Rabinovich.
And John, on the 400, we were dealing with two separate collisions north of the 401. Both northbound and southbound separate issues are both cleared away. On the 401, there is a collision, a stall rather. It's on the east 401 at Carlingview. That's just east of the 427 where the left lane is blocked. It's slow going from Dixie to here, but past there it's busy anyways with volume to be on the 400. Now onto the QEW, we had a triple spot westbound approaching Walker's Line in the left lane, which has since cleared. On the Toronto-bound QEW, approaching Brant, that's where we have debris. Both lanes are affected here. MTO crews are on the scene doing the cleanup right now. Delays are seen coming down the Burlington Skyway towards Brant on that Toronto-bound QEW. And East QEW at Huron, Ontario, a stall that we had in the left lane now clear. Mr. Loop, get your tires changed anytime on your schedule. No appointment needed. Visit Mr. Lube for same-day tire services. Open every day and until 8 p.m. on weeknights. And MRE, your benefit. Global News Radio, 640 Toronto, Chopper Traffic.